If you have tight hamstrings and struggle to touch your toes, no matter how much you stretch, then stay tuned. In this video, I'll share 3 expert tips to boost your hamstring flexibility that I've learned in my 16 plus years as a physical therapist. Now, one of these tips may take a few weeks to kick in, but the other 2 help improve flexibility fast, possibly by the end of the video. So let's get started. Now, before you can learn how to improve your hamstring flexibility, you first have to understand the function of the muscle, as well as why your hamstrings get tight in the first place. And your hamstrings attach from your ischial tuberosity or sits bones to just down below your knee. And because your hamstrings cross both the hip and the knee, they function to bend or flex your knee, as well as to extend your hip. And because your hamstrings cross 2 joints, they are more prone to stiffening up or tightening up. Now, your hamstrings also work in another manner, eccentrically, to control the straightening of your knee or the flexing of your hip when you're walking, or to control the flexing of your hip when you're bending. However, when you lengthen a muscle too far or too fast, there's a sensory organ within the muscle known as the muscle spindle. And that muscle spindle will tell the muscle to contract. And so when you passively stretch your hamstrings, stretch them too hard or stretch too fast, your muscle spindle will kick in and prevent you from stretching. And so we need to overcome that muscle spindle reflex. And in just a moment, we'll go through some techniques to do that. But there's one more function of the hamstrings, and that's to protect your sciatic nerve. Your sciatic nerve runs down the back of the leg and innervates most of the muscles in the leg. That starts out in your lower back, but it's actually continuous with your spinal cord and your brain. And so because your nervous system is continuous from your head down to the tips of your toes, tension in the sciatic nerve can mask as hamstring tightness. So how do you know if you have tight hamstrings or tight sciatic nerve? And how much hamstring flexibility should you have in the first place? Well, we'll go over the answers to those 2 questions now. In regards to how much hamstring flexibility you should have, the classic test is called the 90-90 test, where you bring your hip up to 90 degrees, knee at 90 degrees, and then try to straighten your knee out as much as possible. You should ideally be able to get within 10 degrees of vertical. So if you get all the way to vertical, that would be 180 degrees over your leg or over your knee, and then 90 degrees over your hip. So if you can get 10 degrees shy of that, that's considered normal hamstrings flexibility. Now, if you have a limitation in that, that could be from stiffness in your hamstrings. It also could be from tension on your sciatic nerve. So if you go to the maximum point and then you point your toes and you can go a little bit farther, that indicates either some calf stiffness or possibly some tension in your nerve. Note where you feel the tension in your hamstrings. If it's right behind the knee, then it could potentially be a calf stiffness problem. However, if you feel the tension up here and you move your ankle, that tells you that it's not a hamstring problem because your hamstrings don't attach all the way down to the ankle. Another test would be to lift your head up. If lifting your head up makes the tension in your leg increase, that's another indication that it may be a nervous system problem because your hamstrings only run from your hip to your knee. They don't go all the way up to your brain. And so if you find you have increased tension in your hamstring, either by moving your head up or by pulling your toes back towards you, here's a tip to improve your sciatic nerve mobility. To do this, we're going to use a foam roller to help mobilize the spine, and particularly the thoracic spine. Your spinal cord runs through your spinal column, and so taking tension off the spinal cord can help improve your sciatic nerve mobility. Additionally, your sympathetic chain or your fight or flight system sits on either side of the thoracic spine. And sometimes doing a little self-manipulation or mobilization of the thoracic spine on a foam roller can actually get your nervous system to relax, and you may even notice immediate improvements in your sciatic nerve mobility or hamstring flexibility. So go back and forth on the foam roller from about the top of your rib cage to the bottom of your rib cage, and just roll over the muscles. You may try arching back over it a little bit, extending your thoracic spine, and you may hear or feel some pops while doing this. If you get up to shoulder blade level, you may have to give yourself a hug with your arms to clear your shoulder blades out of the way, and do this for about a minute or so. Then you'll retest your hamstring flexibility. So lay back down and then straighten up. See if you can go farther than you could before. And additionally, check by moving your foot back and forth or moving your head and see if that still affects your symptoms. Now, let's say we've cleared sciatic nerve mobility or everything was normal. Next, we actually need to do stretches to target the hamstrings. But again, remember, when you passively stretch your hamstrings, whether you do it sitting or whether you do it standing or whether you do it with your foot propped up on a chair, you still have that stretch reflex that you need to overcome. And so to do that, we're going to use some neuromuscular techniques. One way that's really easy to do this is in a loaded position, because remember, your hamstrings work eccentrically to control you when bending. So bend down as far as you're able to. Relax your hands on the floor, even if you have to bend your knees. If you can't get there, grab onto your ankles, or you can rest your hands on a step stool. Now, once you're in this position, you want to try to straighten your knees as much as possible. That stretches the hamstrings. It also uses your quadricep muscles. And there's a principle known as reciprocal inhibition, meaning that when you contract one muscle group, the opposing muscle group relaxes. So you're contracting your quadriceps as you straighten your knees to help relax the hamstrings. Go down into a little mini squat, straighten back up, little mini squat, straighten back up. Now, this both acts like a nervous system mobilization, like a nerve glide that you may have seen. It also mechanically stretches your hamstrings while using reciprocal inhibition to inhibit the hamstring muscles. So go through a couple more repetitions of that. Now you can do a self-hamstring stretch where you contract the hamstrings, tighten here, and then allow yourself to lower back down. And tighten again, try to lift yourself up as if you were doing a deadlift, and then go back down. Lift up, and then go back down. This uses the hamstrings themselves to lift you up and then relax. That's a principle known as autogenic inhibition, that when you contract the muscle itself, it goes through a relaxation period afterwards. So to review those two techniques, you have reciprocal inhibition, where you straighten the knees, use the quadriceps to inhibit the hamstrings, and then autogenic inhibition, where you contract using the hamstrings as if you were lifting up doing a deadlift, and then allow yourself to sink back down a little bit farther. And then lift up, and then allow yourself to sink down a little bit farther. Then after doing that, you can recheck and see how far forward you can bend. Now, why do these neuromuscular techniques work? When you contract a muscle, you have overlapping filaments that slide back and forth like this. When a muscle is contracting, those filaments ratchet down to shorten the muscle, and then when you stretch a muscle or relax a muscle, those ratchets let go so that the muscle can lengthen back out. And you have those series of filaments or sarcomeres back to back to back in a muscle. Now, when you stretch a muscle, it's not like pulling a piece of taffy or stretching a rubber band, because those sarcomeres are layered back to back to back. Now, if you have a knot or a contracture in, say, one sarcomere, where it's a little bit stiffer than the other ones, then when you go to stretch a muscle, no matter how hard you stretch that muscle, it's the ones that stretch more easily, that stretch the most, while the stiffest ones stay stuck. So that's why hard passive stretching doesn't work, because it just lengthens what already lengthens well, while leaving stiff what's already stiff. However, to lengthen a muscle over the long term, you do need to take it to its end range and leave it there for a long period of time. So using those neuromuscular techniques helps to unlock the parts of the muscle that are already too stiff. But once you've done that, you still need to lengthen the whole muscle to its end range in order to cause an adaptation. So the first way that we stretch a muscle is by getting all of the sarcomeres to stretch out and lengthen to their maximum length. However, after you've done that, you may find that you improve with stretching but then hit a plateau. And the reason for that is to gain further length, you actually have to add sarcomeres. And that process takes a while. Now, to cause a muscle to adaptively lengthen or add sarcomeres over time, you have to leave it in a stretched position for a long period of time. So the 15-second or 30-second stretch that you may be doing probably isn't enough. You probably need at least 2 minutes to 5 minutes per day, and possibly up to 60 minutes in a lengthened position per day. So doing a stretch where you're in a relaxed position like this, and then being able to maintain that for a long period of time, possibly up to an hour a day, can help to lengthen or add sarcomeres over time. And to do this, get your leg up where it's straight, where you've got knee extension, hip flexion. It also helps to have the opposite leg hanging down to kind of lock your pelvis in place and not allow your pelvis to round. Then just do a gentle lean into the stretch, doing some deep breathing can help. And this shouldn't be a hard, aggressive stretch where you're really pushing or straining, because again, that'll kick in the muscle spindle. So just going until you feel a comfortable, easy to maintain stretch, and then staying in that position for a prolonged period of time can help you to add sarcomeres to your muscle over time. Now the question is, do you really need to stretch that long? And that ultimately comes down to what functions your hamstrings are stopping you from doing. During most everyday activities like walking, we don't get anywhere near the end range of our hamstring range of motion. It's really only with bending or activities like that where your hamstring flexibility is really going to limit you in your everyday life. And if you do need to bend to pick something up, there's no rule to say that you can't bend your knees while doing it. So if you would like to improve your hamstring flexibility, try those tips, see if they help, and leave a comment below letting me know how they helped. Now, muscle groups that will limit your daily function include your hip flexors and your calves. Those are the two muscle groups that are going to impact your function most when walking. And you can check out tips to improve flexibility in those muscles in these videos over here. But before you go check those out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.